Knee pain is the most common injury we see as physiotherapists. This is certainly true in runners, where knee injuries account for over 50% of all running injuries. The most common knee-related running injuries are patellofemoral or kneecap pain, patellar tendinopathy, which is sometimes known as jumper's knee, or ITB syndrome, which presents as pain on the outside of the lower thigh. There's often a biomechanical basis to this type of pain, both for short and long-term injuries, which is why we benefit from using a tool like the 3D gait analysis to dive just a little bit deeper into why people are getting this type of injury. At Fortius, we perform 3D gait analysis on a force treadmill, which gives us the ability to see things we can't normally see with video or the human eye alone. There are three key elements to our gait analysis. The first is a runner's cadence, which is the number of times that your feet touch the ground in 1 minute. Runners with recurrent injuries typically present with a lower cadence, often less than 150 to 160 steps per minute. A slow cadence can cause a number of other factors, such as overstriding, which is the foot landing too far in front of the body. Using the treadmill, we can measure your cadence as a first step, and then combine that with the next two items for a fuller picture. The second thing we look at is the coordination between body segments. In running, each segment of the pelvis, thigh, legs, and feet need to move in relation to each other. It's invaluable to look at a runner's technique to try to work out what might be driving your pain. Factors such as how the hips are controlling the position of the knee and how straight the knee is on landing. Additionally, poor hip or glute control can cause the knee to fall inwards or even be held outwards, and this is a big driver of knee pain. One area that you simply can't see on a normal gait analysis is the forces acting on your body. The body is always subject to forces as we run. For instance, the equal and opposite force that the ground exerts on us every time we land. However, biomechanical errors can cause these forces to be suboptimal. For instance, landing heavily or with the foot too far forwards can cause a decelerating force, which will slow the body down every time the foot hits the ground. These forces can then be directed towards the knee. Optimizing a stride pattern can change these forces and not only prevent injuries but can also improve performance. Looking at your cadence, your coordination, and the forces acting on you when you run gives us a comprehensive picture as to what might be causing your knee pain. The 3D gait service used here at Fortius is a tool that allows us to truly individualize analysis so that we can work out what's driving your knee pain rather than just relying on population data. Based on the results, we can then refer you to the best person to work on your specific factors, whether this be a sports therapist, a strength coach, or even a running coach. Thanks for tuning in. We'll be back next month with another Sports Science Explained topic.